Welcome to Impact Signals, Social Impact at the Scale of AI. I'm Charlie.
And I'm Sarah.
It's Sunday, August 9, 2026, episode 98. Today, AI is moving into the institutions that already hold the data. Gujarat's education department is flagging students at risk of dropping out before they disappear, and Ahmedabad Hospital says its monitoring command center has headed off 115 code blue emergencies. And California's Cottage Health becomes the first health system to deploy Thesis's AI care team agents. We start in India, where Gujarat's education department, working with Wadhwani AI and UNICEF, the United Nations Children's Agency, has built an AI early warning system into the state's child tracking system to predict which primary school students are likely to drop out before they do. In its first year, it flagged roughly 167,000 at-risk students, 55% of them girls.
What makes this significant is the data source. The model reads records the state already collects: attendance, assessment scores, age, disability status, sibling details, and family circumstances. No new surveillance, no new collection, just a prediction layered on an enrollment census covering more than 10 million students.
Vibes of India and Outlook India reported the numbers on August 8. The system spans all 37 districts and more than 50,000 government and grant and aid schools. And for the 2026-27 school year, it has identified another 118,000 students at risk, making this one of the largest live deployments of predictive AI in public education anywhere.
The model is the easy part. The hard part is the follow-up, and here the design is explicit. Flagged students get human attention, not automated action. Teachers and local officials are directed to counsel families, and in documented cases, that meant connecting a family to financial support schemes that kept a 13-year-old in school.
And the state's parallel re-enrollment effort through the same child tracking system has brought more than 90,000 former dropouts back into school.
The system is now in its second full cycle, which is where the evidence on whether flagged then counseled students actually stay enrolled will accumulate. State officials are clear the tool identifies warning signs only. It does not claim to fix the poverty or child labor behind them. And other Indian states are already being pitched the same blueprint, built on enrollment data they already hold.
Second signal, still in India. Marengo CIMS Hospital in Ahmedabad published a running tally on August 8 from what it says is Gujarat's first round-the-clock AI-powered remote monitoring operation for high-risk cardiac and critical patients.
Right, and the operational footprint is the notable part. Wearable biosensors stream heart rate, blood pressure, respiratory rate, and oxygen saturation to a command center staffed around the clock, covering patients in the hospital, at home after discharge, and while traveling.
The numbers are specific. Bilkul Online reports that over roughly 2.5 years, the platform has monitored 6,551 high-risk patients, and the hospital counts 836 deteriorations caught early, 115 code blue emergencies avoided, 81 intensive care transfers prevented, and 3 resuscitations triggered by remote alerts.
Those are the hospital's own figures, and the design keeps the AI in a flagging role. Alerts route through trained clinical teams to the treating doctor, who makes the call. A multi-year operational tally is also a different class of evidence from a pilot announcement. It is what the R.W.J. Barnaba's deterioration study gave U.S. hospitals, which we covered July 31, now coming out of a mid-income health system.
Story 3, and a governance note. The World Health Organization published its first global research agenda on health, migration, and climate change, announced August 5 after a July 22 launch webinar that drew more than 300 participants from over 75 countries.
What makes this significant is where the money goes next. Research agendas set funding flows. This is the document national health ministries, research funders, and UN agencies will cite when they decide which climate migration health studies get funded over the next several years.
The priorities span social determinants of health, universal health coverage, and emergencies, plus cross-cutting work on data and policy. The named gaps include migration-sensitive health data systems, preparedness for climate-related emergencies, and evidence on mental health and maternal and child health among climate-displaced people.
The data systems gap is the opening for this field, who has now stated formally that the evidence base on climate-displaced people's health is too thin to steer policy. For teams building health data pipelines, that is a named gap with a funding agenda now attached.
Moving to the United States. Cottage Health, the nonprofit system serving California's Central Coast, announced August 4 that it will be the first health system to deploy care team agents from Thesis Care, a New York company founded in 2024.
The scope is the story here. The agents start in care management and clinical operations, patient engagement, follow-up after visits, and walking patients through next steps in their care plans. That is the routine, time-intensive work clinical teams struggle to keep up with, and it is among the least staffed functions in U.S. health systems, which is where care plans quietly fail.
The Lompoc Record, Santa Maria Times, and Santa Ynez Valley News carried independent local coverage on August 7. Cottage officials framed the technology as supporting clinicians, with the AI handling outreach and follow-through while care decisions stay with staff.
For practitioners watching the agent wave, the marker is who moved first. A regional nonprofit system, not an academic giant, with a stated scope of engagement and follow-up, not diagnosis. That makes this deployment an early test of the narrow agent model in a community setting, and as Thesis's first health system customer, Cottage is where the results will show up first.
And a fifth story from nonprofit operations. Glue, the technology platform serving faith communities and nonprofits, announced a definitive agreement August 5 to acquire Cedarstone, a firm providing outsourced accounting, donor operations, and fractional chief financial officer services to nonprofit organizations.
Most AI for nonprofits news is about program delivery. This deal targets the back office underneath it, bookkeeping, donor operations, and financial controls, where small organizations lose staff time and fail audits. The deal is expected to close in Glue's third quarter, terms undisclosed, with Cedarstone keeping its own brand and leadership. That close date is the verifiable next step.
On the disaster watch, GDAX, the Global Disaster Alert and Coordination System, has orange alerts on 3 fronts. A magnitude 6.3 earthquake near Sarangani in the Philippines, with an estimated 10,000 people exposed to severe shaking. Typhoon Dolphin, still active in the Northwest Pacific with maximum winds of 269 kilometers per hour and more than 11 million people exposed across the Marshall Islands, Japan, and China, and a multi-country drought across the Democratic Republic of Congo, Kenya, Tanzania, and Uganda. Relief Web is also tracking ongoing monsoon flash flooding across multiple Indian states.
The East Africa drought is the live link to today's research story. Who Knew Agenda names preparedness for climate-related emergencies as an evidence gap, while that orange-level drought sits across 4 countries. Exactly the slow-onset displacement driver, the agenda says the field cannot yet measure well enough to steer policy.
Funding Watch, the Innovate Africa Challenge, run by Smart Africa with the UN Food and Agriculture Organization, is open to African AI for agriculture innovators, with a deadline of August 31, 2026. This is the 3rd edition, themed from ideation to deployment.
The catch is the stage. This edition's focus is deployment, tools already working on farms rather than concepts. African teams with a live agriculture deployment have about 3 weeks until the August 31 deadline.
The through line today: AI is moving into the institutions that already hold the data. A state school census in Gujarat, a cardiac ward in Ahmedabad, a California health system's follow-up calls, and the results are being counted in students kept and emergencies avoided, not in demos.
And across all of today's stories, the pattern held. No new data collection, a prediction or an agent layered on records institutions already keep, and a human, a teacher, a nurse, a care manager, still making the call.
That's Impact Signals for Sunday, August 9, 2026. If this briefing is useful, subscribe wherever you get your podcasts. Check us out at impactsignals.ai and share it with someone working in the field.
Stay ready.